Hey guys, welcome back to another Optimized Nurse video. So yesterday we continued our time management theme, and we discovered the amazing power of baking those ways into our day, day after day. So we remembered that we can't be all on, like the heart was always in systole. It wouldn't do any good, right? Because remember, it gets its rest in diastole. When it's in diastole, that's when you get its blood flow. So, and then we also compared that to the cardiac tampanode. You remember the sac around the heart, the more pressure exerted on it, nothing in, nothing out. If you don't remember that, you can go back and check it out, that other video. But that's exactly, we compared that to the nurse that tries to run at 100% all the time. With eventually all that pressure is going to put the patient in PEA and put you in PEA as well. You look good on the monitor, everything looks good on the monitor, you got everything looks good, but there's nothing coming out on the other end. So that's kind of the way that you need to look at your breaks, and how you can, if you want to show up and perform at a high level, you got to remember that that you're putting yourself in tampanode when you're not taking breaks. You're going to go into PEA eventually, and you're going to get burnt out, and you're going to have to quit, and I don't want that. So anyway, so today we're going to continue that time management theme and talk about an idea that helped me a lot. It's called bookends. AM and PM bookends is what I call it. It's the beginning of your shift and the end of your shift, bookends. So these are, remember, in a couple of videos ago, we talked about how Peter Drucker says that time blocks are the #1 power tool for getting things done, right, for time management. So this idea is going to take that to the next level, would be my AM bookend. So personally, I can use this at home and at work. So at home, what I do is, my AM bookend is what I'm doing right now. I wake up and I pray and I meditate and I read and I make these videos for you. All of that is before inputs. I don't let anything input into my mind before I create. I'm creative. I get my foundational things, all my foundational things done before we let inputs into our day. Same thing as a nurse. When I'm training people, either just regular orientation or if I'm training them for charge, especially when I'm training for charge. This is a concept we go over a lot. It's, you have this time in the morning, take advantage of it and get all your checklist things done, because for the rest of the day, you're just putting out fires. It's like you are literally a firefighter. You're running around the unit and you're going to put out fires, and you're going to wait until this admit gets here, and then you're going to have a code, and then you're going to have to do this and then this. Like you have this much time that you know what's going to happen, and the rest of the time, you never know. And sometimes you start your day off with the code. That's the one big thing about charging is you got to be on top of it, and you can't be waiting on somebody or someone else to tell you what to do. So yeah, so that's the AM bookend. So you have to bookend your time before distractions. No distractions until you have your deep work done. So in the morning, like what I do in the morning, here's my ugly drawing again. So my AM bookend is after I get my breakfast. And I don't get any distractions until I can go down and eat my breakfast. And then we'll start putting out other fires. But because I know that if I don't get my rest, if I don't go into diastole every once in a while, I'm not going to be able to show up best for my patients. And eventually that's really going to wear me down. So remember that idea, the tampanode idea. Go back and watch that video. It's so important for you to understand that concept of one, for your patients, what cardiac tampanode is and PEA and where it leads to, and then how literally you're doing the same thing yourself, but slowly, if you don't take care of yourself. So the challenge for today is, how are you going to implement this into your day? Think about next time you're starting your work. Okay, I'm going to do my charts. So for me, I would always get my charts, my assessments done, obviously assessments, charts. I would get my, what's it called? Meds passed, all that fun. I would get all the really important, kind of like all around 9 o'clock stuff that usually, however your hospital does it, but, start off the day until about 9 or 9:30. I'm after it. I'm getting after it. I'm not wasting time. I'm not letting people distract me. You might have to say no to some people for a minute because they might just want to be chatty. You know, they might just want to be chatty instead of getting the work done. And your focus on the task at hand. I promise this is the best way to do it. So, just remember at the beginning of your day, that's what you have most control over. And I'll bring you some other good stuff tomorrow. All right. Yeah. Until next time, we'll see you later. Bye.